Hello. Hello, my hospice family. Come on in, come on in. Welcome back, y'all. Welcome back, everybody. Welcome back to DunsHospice. Okay. My name is Nurse Dawn, and I shall be your RN, your hospice RN. Okay. This evening, all right, come on in, my beautiful people. I am so thankful. I am so happy to have you guys. Hello, Savannah, my #1 supporter. How you doing, girl? How you doing? How are you doing today? How's everything going with you? Let me know. Okay. We are here and we are going to be talking about it. Hospice and anxiety. Yes, you're back from California, right? Is it California? I'm glad you made the trip back and forth. Are you back in school now? Wait, it was Florida. You know what it is? Yes, okay, Florida. Yes, thank you. I knew it was either Florida or California. Okay, so you are back in school. Perfect. Okay. Try to get all A's and B's. Okay, my dear? All A's and B's. Now you're back from your vacation. You are nice and relaxed, right? You're nice and relaxed. You're back from your vacation. And now it's time to get them grades. Perfect. All right, guys. Come on in, my beautiful hospice family. Come on in. We are going to be discussing today. We are going to be talking about anxiety. Okay, we are going to be discussing hospice care and anxiety for both the patient and also the caregivers. Okay, you as the caregiver who's taking care of a loved one who's very sick. Okay, you as a caregiver who's taking care of a loved one who has a terminal illness. What are some anxieties you may face? What is your anxiety? Like, what are you anxious about? And what are the tools? What are the tools you need to help with your anxiety level? Okay, when you're taking care of somebody who's at end of life. Okay, so that's what we are going to talk about, and that's what I'm going to help you guys to deal with. And you as the patient, you as a patient who is going through this, what is your anxiety? Like, what are the things you may be anxious about? Okay, we are going to talk about it, my beautiful people. Yes, we are definitely going to have this discussion, okay, regarding how to manage anxiety when you are at end of life. Okay, from both aspects, from both the patient and also the caregivers. Okay, now for those of you who's watching who may not know me, my name is Nurse Dawn. Okay, my name is Nurse Dawn. I am a hospice registered nurse. I've been a nurse since 2010, out of which I've been a hospice nurse since 2012. Okay, guys, I've been a hospice nurse since 2012. So I definitely, have had experiences. Okay, I've had many experiences entering into wonderful caregivers homes, okay, and taking care and having the honor of taking care of patients who are at end of life. Because what do you do when your mom, your dad, your husband, your wife, your grandma, your grandpa, what do you do when somebody you love is at end of life? is dying. So that's what we are going to talk about. Like, that's what we talk about in this channel. And I am here. Use me as your hospice nurse. Let me know if you have any questions, guys. And also, if you are interested, I wrote this book right here with my picture on it. Okay, it is on Amazon, and the link is in the description. Okay, if you want to learn more about hospice, please grab this book right here. Okay, with my picture on it. Okay, I wrote it about, I think about 3 years ago or so, and it's really helpful to any caregivers out there. Okay, if you are a caregiver and you are, or even if you are in the medical field and you are curious about hospice, you are curious about end of life, I strongly recommend you grab my book right here. Okay, grab this book. I'm so proud of it. Okay, that's my first book, and it's on Amazon for you right now. Okay, all right. Now, that being said, how to manage anxiety. Okay, how to manage anxiety when we are in hospice, when we are at end of life. Okay, now, if you are the caregiver, I strongly want to let you know, okay, I am here to encourage you and to let you know that you are doing a great job. Yes, you are doing God's work. You are doing a great job. And it's okay. There is no right way. Okay, there's no perfect way. There's no one way that matches everybody. Everybody's case is different. Everybody's case is unique. Okay, so what one person is doing for their loved ones who's dying might not work for the next person. So I want you to give yourself some grace. Okay, I want you to give yourself some grace. Okay, I want you to give yourself permission. Give yourself permission, give yourself some grace, and know that you are doing a good job. Okay, you are doing a fantastic job. You are doing God's work. Okay, and it doesn't matter about getting it perfectly right. What really matters at the end of life is love. Okay, if you try your hardest, if you are willing to be patient, and if you are willing to change your mindset to have a new normal. Okay, I like to tell my hospice family, it is gonna be your new normal. Okay, I'm just putting on the fan, guys. It's gonna be your new normal. Okay, you are doing a great job. So that's what I want to say first of all. Okay, I want to let you guys know, first of all, don't be so hard on yourself. Okay, the number one way to manage anxiety when you're taking care of somebody who's dying is by knowing and by giving yourself some grace. Okay, give yourself a grace, because oftentimes we get ourselves all worked up for nothing. Like, what we are worried about does not happen. Okay, and most of the things that I hear my caregivers say is, I don't want my loved ones to suffer. I don't want my dad to suffer. I don't want my mom to suffer. Is it going to hurt? Are they going to be in pain when they're dying? I don't want to see them in pain. I don't want them to be suffering. And I'm here to let you know that when we sign our loved ones under hospice care, and we have the hospice team, such as the nurse, okay, myself, such as the nurse, the social worker, the hospice aide, the spiritual care coordinator, the hospice volunteer, when we have the whole group come together, okay, to take care of your loved ones, we are on top of their pain. We are on top of their condition. You see? So that condition will not get worse. We will be able to manage their symptoms. And so they're going to be very comfortable at end of life. Okay, they are absolutely going to be comfortable at end of life. So I want you guys to, give the hospice staff permission to help you. I like to say to the families, help me to help you. Okay, help me to help you. All right, like, and I really want us to understand that. Okay, my hospice caregivers, like, let me know if you have any questions. Your loved ones giving proper care by the hospice staff will definitely have a comfortable death. Okay, they will have a comfortable death. They will have a comfortable passing. Okay, like, who among you watching is in the medical field? Who among you watching is a caregiver? Somebody at end of life, or somebody with a terminal illness, or you've taken care of somebody with a terminal illness. Okay, let me know, guys. I would love for you to share. But yes, that is the number one way to manage anxiety, is by allow the hospice staff, okay, to help you. I always say, help me to help you. Okay, because this may be your first time. This might be your first time that you're taking care of somebody who's dying. But the hospice staff, okay, the hospice staff is well versed. Okay, they know all about it. So please help them to help you. Okay. Savannah says it's sunny and raining. Yeah, that's what happens. My grandmother used to tell me when I was a little girl, if it's sunny and raining at the same time, then that means the angels are crying. Have you heard of that? I thought that was kind of strange, but that's what they used to tell me when I was a little girl. Like, when I would hear or see, it's sunny and raining at the same time, they would say, oh, it's a sign that the angels are crying. Okay, guys. So the other way that I would recommend us to handle anxiety when under hospice care is to keep on top of the treatment plan. Okay, like, for example, give the patient medications as ordered. Okay, so if the hospice nurse recommends you give the pain medication every 4 hours, please give the medication every 4 hours. Because from my experience, like, what I've noticed is that the family would give the medication at, like, say the family gives it at 8 a.m. and then again at noon. Okay, and the person seems to be very comfortable, they would skip the 4 o'clock med. Okay, and sometimes even they would skip the 8 p.m. dose also. That results in the patient, like, waking up in the middle of the night screaming out in pain. And so when we ask the family, how come you did not give them the 4 p.m. dose or the midnight dose, oftentimes the family would say, well, she looked comfortable. She did not look like she needed, the pain meds, or he did not look like he needed the pain med. But, we have to understand that the reason the patient was comfortable was because the medication was in their system. You see? And so a lot of it is teaching. You see? It's teaching, it's educating the family to know we don't want to be playing catch up. okay? Because when the patient wakes up in the middle of the night screaming in pain, that's anxiety, you know? That will definitely make you feel anxious. That will definitely make the patient be anxious, be fearful, okay? So to prevent that from happening, to prevent unnecessary anxiety, give the medication as ordered, as prescribed, okay? Do the treatment as prescribed, as recommended by the hospice nurse. Okay, my beautiful people? Let me know, guys. Let me know if you have experience with that, okay? If you have experience with like skipping a medication, or not taking a dose because you feel better at the moment, only to find out like maybe a few hours later, like boom, the pain just, the symptom just come at you all at once. It kind of magnifies, okay? So that will definitely, that's another way to help you to decrease anxiety for both you as a caregiver and also the patient, is to be sure that you are giving the medication. Be sure you are giving, the treatments exactly as it is ordered by the doctor. All right, guys? Even if the person looks comfortable, don't be fooled. The reason why the person is comfortable is because we were giving them the medication in a consistent manner. All right? So if we stop giving the medication, they're going to be uncomfortable, and therefore that's going to increase your anxiety level. All right, my caregivers? So let me know, guys. Let me know. Talk to me. Subscribe if you haven't done so. Give me a like, share. Are you a nurse? Are you in the medical field? Are you a caregiver? Okay, have you, ever taken care of somebody who's at end of life? If you're anxious, what have you done about it? What has helped you? So that's 2 strategies so far, okay? So far, that's 2 strategies that I've used, that really help. Let's see, what does my friend Savannah says? I have ADHD and I take pills for that. Doesn't matter if I don't take it. Yes, my friend, this is exactly what I'm talking about. It does matter if you don't take it. Let me ask you, do you notice a difference when you don't take it versus when you take it? Do you notice your attention span differs? Is there a difference? Yes, then there you go. Then that's your answer, because I guess it's human nature, guys. I guess it's human nature. And like I said, don't be so hard on yourself, okay? Don't be hard on yourself, because a lot of the things that we do is just human nature, and we have to just be conscious of it, okay? Because when we take a medication, we feel better. And so now we are thinking, oh, I feel better, so I don't need it, And then a few hours goes by, a day or 2 go by, and we start from, ground zero again. So definitely take your meds, okay? As prescribed by your physician, unless otherwise noted. Hey Zaid. Hey Zid, how you doing, my friend? Thank you for being here with me this afternoon, this evening, wherever you are. I'm from Massachusetts. Okay, I was born in the Caribbean. I was born in Haiti. Okay, I am Haitian, but I grew up in Massachusetts. Okay, so I'm from up north. Okay, Massachusetts. Boston in the house. Yes, my beautiful people, let me know if you have any questions, okay, guys, in regarding to anxiety and taking care of your loved ones, okay? Because this is something that absolutely impacts a lot of us, you know? And it's perfectly normal. It's perfectly normal, you know, to feel anxious because the person, you love them, you know, that's your loved ones. And it's hard for you to imagine your life without them, you know. I get it. Trust me, you know. Because as I mentioned to you guys before, my father, okay, my own father right now, he's under hospice care, you know. And I guess that's another reason why I'm so passionate about this field, about this career that I chose to, you know, to undergo. And I'm so passionate about it. And I have so much love and compassion for people who are dying, for people who, you know, with illnesses, um, because it's just really, how can I say this? It's doing God's work, you know. That's what I can say, is doing God's work, you know. That is as close as you can come to, it's like letting go of all the ego, all the selfishness, you know, like me, and just really loving on the person without expecting nothing back. You know how like in society, we usually do things because we expect something back. You know what I mean? Like, you know, for example, we go to work because we expect a paycheck. You know what I mean? Um, Even things like going to the gym, for example, you know, because right now, my new my new thing, I guess you might want to call it thing, I don't know, but I'm working out. You know, I am working out. I go to the gym at least 4 times a week because I expect to have a healthier body. You know what I'm saying? Like, we do things because we expect something back for the most part. But when you're caring for somebody who's dying, there's no, you don't expect to gain anything back. You are just honestly doing it out of the goodness, out of the genuine goodness of your heart, just pure love, you know, just pure love. Savannah says, you, yes, Savannah, yes, I do, my dear. Yes, I do. Thank you for asking. Thank you. Yes. Um, so yes, my husband's family, like, one of the other way that we can definitely help with anxiety is by asking for help. Okay, if you have a neighbor, if you have a sibling, okay, if you have, you know, somebody else in your family that can help you, ask for help. Like, don't be shy, don't be timid, you know. Ask for help. Like, oftentimes we feel like, oh, I don't want to be a burden, you see. Oh, I don't want to burden them with my problems and this and that. And from my experience, if you are not willing to ask for help, you're going to get burnt out. And when you are burnt out, you are no good to nobody. Okay? You are no good to yourself, and you're definitely no good to the person you're supposed to be taking care of. So if a neighbor comes to your house and asks you, what can I do? Give them something to do. You could tell them to, can you please cook me dinner tonight? You know, can you go to the store and buy me some bread, some milk, you know? Can you come and stay with dad for 2 hours while I go do some shopping, or while I go, you know, for a walk, or whatever that you need to do? You know what I mean? If you come from a big family, take turns. Take turns on who's going to help which day. You know, you could say, okay, Becky, you take Friday and Saturday night. John, you take Sunday, Monday, you know, and Betty, you take Monday, Tuesday. Okay? So definitely, you know, take turns, like ask for help. Savannah says, what if someone does not want to be in hospital? Then that is their right. You know, like nobody can force anyone to do whatever, anything, you know, like as a patient, you are in control. That is your right. It is absolutely your right if you don't want to be under hospice care, you know. But what I'm here to inform and to let you know is that when you're under hospice care, it doesn't mean you are going to die today or tomorrow. Hospice care means that a whole lot of professionals, a whole lot of, you know, medical professionals will help you to manage your symptoms at end of life. You know, healthcare professionals like myself and my colleagues will help your family, will be a support. But you don't have to do anything but breathe. The only thing that we have to do is breathe, okay? So everything is an option, okay? But I know from experience, people who are under hospice care have a much more peaceful death, okay? Peaceful dying. Because hospice care means that the illness, there's no cure for the illness that you have. You know, whether it's cancer, it's pancreatic cancer, you know, any kind of cancer. If you have liver disease, if you have lung disease, COPD, if you've had a stroke that really damaged you, you know, ALS, okay, MS, you know, end-stage dementia, end-stage Alzheimer's, kidney disease, kidney failure, you know. So it's like all of these, like any and all of these, you know, diseases where the doctors say they've done everything that they can do, and the best thing to do is just go home and be comfortable, you see. So you don't have to be under hospice care. Absolutely not. It is a choice. And oftentimes what happens is that the family waits. The family waits until it's too late to put their loved ones under hospice care. And by then, the staff is just playing catch up. You know, the staff is playing catch up. Things could be kind of chaotic versus if you put the patient under hospice care in the beginning, everything will be a lot more smoother, you know? Like we wouldn't have to be playing catch up. All right, my husband's family. But that's a good question, Savannah. Thank you, sweetie. That is awesome. What do you want to be when you get older? Do you want to be in the medical field? Like, have you thought of what you want to be when you get older? What's your career path? Are you going to be a doctor or a businesswoman? What are you going to be, my dear? All right, my hospice family. Well, if you guys don't have any questions, I've been on here for almost 30 minutes now. Oh, you want to be a zookeeper. You like animals? You like pets? What kind of animals do you have? Like, what kind of pets do you have? Let me know. Yes, my beautiful people. Okay. Do you have like any cats, any dogs, a hamster, 2 dogs? That's awesome. That's awesome. Good for you, Savannah. Yes, my hospice family, like I said, please be sure to subscribe, okay? Give me a like, subscribe, be part of the family, all right? Be part of the family. Hit the notification bell so you'll know each time I am live. I try to go live at least every day or every other day, okay? It depends on my schedule, all right? Your favorite animal is a fox? That's interesting. And what is the reason for that? I don't think I've ever met somebody whose favorite animal is a fox. What's the reason behind that, my dear? I'm just curious to know. Why do you like foxes? Let me know, my dear. You don't know why you like fox, but you just do. I just really like them. Wait, there was a movie, like, isn't there a famous movie out there where like there's a fox in it? Huh? I think there's a famous movie out there where there's a fox. Why can't I think about that movie? I don't know, but yeah, I think when I was a little girl, there was this movie that I used to see with a fox in it. If I recall it, I'll tell you next time, Savannah. I will let you know, okay? All right, my beautiful, beautiful hospice family. Like I said, I will see you guys in the next video. Thank you, Savannah, for, being here with me this afternoon. I always like to chat. Thank you, everybody, for watching, okay? And hopefully next time you guys will comment, ask me any questions about hospice, end-of-life care, death and dying, okay? I am here at your service, all right? Mwah. See you in the next video. All right, guys, take care.